Health equity is an important part of public health practice. But what is health equity? And what does it have to do with environmental public health? Do practitioners such as environmental health officers or public health inspectors have a role? Let's start with the social determinants of health. These are the interrelated social, political, economic, and environmental factors that create the conditions in which people live, learn, work, and play. Life circumstances that are separate from the healthcare system can impact people's health now and into the future. Social determinants of health include access to nutritious foods, housing, income and job conditions, social support networks, culture, and education. These things can impact our health more than our genetic makeup or healthcare system do. People who don't have enough money to pay for quality housing may be exposed to unhealthy environments. Maybe they live near a busy roadway, have mold growing inside, or live without safe playgrounds for children. A single parent with 2 jobs may not have time or money to prepare wholesome, homemade meals for the family. Someone who struggles to read labels or look up health information will be less able to protect himself from toxins or use household chemicals properly. People who have trouble getting around, who lack money for bus fare, or who have no internet access, may have less access to public services that keep them healthy. There are many reasons why some people lack the power to take care of their own health. Unlike illnesses caused by genetic makeup, health inequities are caused by social disadvantage, are modifiable, and considered unfair. Health equity is a situation in which all people have a fair chance to live a healthy life without being disadvantaged by their social, political, economic, or environmental conditions. So health equity means everyone gets treated the same, right? Not exactly. Equity is different from equality. If we treat everyone exactly the same, there may still be inequities. Imagine 3 kids trying to see over a fence to watch a ball game. To treat them equally, we give each child 1 box to stand on, but the smallest child still can't see. To achieve equity, we recognize that the tallest child doesn't actually need a box, but the smallest one needs an extra boost. Now they can all see over the fence. What this shows us is that different people will need different levels of resources in order to reach their full health potential. Another way to think about achieving health equity is to consider changing the game entirely. If we replace the solid fence with a see-through one, or take it away entirely, everyone can see without needing a boost. What does all this have to do with environmental health officers? When you inspect premises, issue permits, and enforce public health regulations, don't the same rules apply to everyone? They do, and you spend a lot of time educating people. But it can help to think about how things like poverty, food insecurity, or mental health affect your clients. Social determinants influence whether people can follow your advice. There are 3 ways to think about how your role relates to health equity. First, there could be a lot happening behind the scenes to create barriers to compliance for those people you work with. If you are able to recognize these factors, you may be able to work more effectively with people. Second, if you can look at the bigger picture, you may find situations in which well-intentioned public health advice could actually increase inequities related to people's social circumstances. And third, there may be situations where you, as a frontline public health professional, are able to identify and possibly help address some of the social, economic, or environmental factors that are creating barriers or health issues for your clients. Watch the next video in this series to learn how the different social determinants can impact your practice.